Okay, good morning everyone. My name is Tim Rutter and I'm with the Department of Mental Health. And I work at the Division of Alcohol and Drug Abuse and Comprehensive Psych Services. I have a degree in social work from St. Louis University. I am a certified alcohol and drug counselor and used to work in an inpatient facility with adolescents before taking my current job with the department on a federal grant called Access to Recovery that provides funding for substance abuse services. I've been asked to present today regarding the substance abuse issue on the ROSI interview questions and to increase your understanding and awareness of what substance abuse is and how it relates to homelessness. I hope to help prepare you to connect your clients to appropriate resources available in your community as well. Today we hope to achieve a few different things. I will be talking about the following. I will be providing an overview of substance abuse disorders. I'll provide information regarding substance abuse in the United States and Missouri. I will talk about certain populations of concern. We'll provide an overview of commonly used substances, go over the ROSI interview question, review questions to ask, and provide tips on interviewing. We'll also talk about how to determine whether or not this is a disabling condition. And finally, we'll provide you with some resources. To begin, there are a few myths associated with substance abuse and drug addiction. There's often a stigma attached towards people with substance abuse problems because of a lack of information, and there are definitely some preconceived notions. These are a few myths regarding people's beliefs regarding substance abuse. Many people believe that drug addiction is voluntary. While initial use may be choice, addiction is characterized by physiological changes in the brain and is appropriately considered a disease through the American Medical Association. And I'm going to read to you the American Medical Association's definition of addiction. Addiction is a primary, progressive, chronic disease with genetic, psychosocial, and environmental factors influencing its development and manifestations. The disease is often progressive and fatal. It is characterized by impaired control over the use of substance, preoccupation with the substance, use of the substance despite adverse consequences, and distortions in thinking. Secondly, the second myth that I have there, many people believe that treatment does not work. In fact, research does show that treatment can be effective. There are many evidence-based practices. However, treatment is not generally a one-time event. Relapse is part of the treatment cycle. Often in treatment centers and programs, they will have relapse prevention groups, and they will go over that, what to do in case of relapse. And the last one, addicts cannot recover. Individuals can and do reach stable recovery. It can take multiple treatments over the course of multiple years. Often we have what we refer to as stages of change. Those stages include the pre-contemplation stage, where a person may not recognize or be aware that they have a problem. Contemplation, where they're thinking about possibly getting help and addressing their problem. Preparation, gathering resources, getting ready to enter a treatment site. Action, that's actively working on your addiction. That can be while you're in a treatment facility, utilizing recovery supports, going to outpatient treatment. Maintenance. Often this is what you do after you perhaps leave treatment and you're back in the community, back in your house. You're attending 12-step groups. And the last stage of change is relapse. And we mentioned above that relapse is the norm rather than the exception. And, if relapse does occur, you don't automatically go back to the pre-contemplation stage. You may go right back to the action stage. You may go right back into treatment. Here are some statistics regarding alcohol and drug use, both in the country and in Missouri, that are helpful in understanding the scope of the disease. An estimated 22.6 million are currently using illegal drugs. And I computed some of the numbers and found that that's 7.26% of the population. An estimated 7.1 million of those meet the clinical definition of abuse or dependence for illicit drugs, which computes to about 2.28%. An estimated 17.9 million meet the clinical definition of abuse or dependence for alcohol use, which is almost 6%. And in Missouri, an estimated 370,000 are currently using illegal drugs, which is 6.2%, which is actually a little lower than the national average. An estimated 123,000 of those meet the clinical definition of abuse or dependence for illicit drugs, which is about 2%. An estimated 439,000 meet the clinical definition of abuse or dependence for alcohol use, which is just above 7%. And I computed those numbers in Missouri utilizing the 2010 census, where Missouri's population was listed at a little over 6 million. Here's a slide that breaks down alcohol and drug use illustrated by demographical information. You'll notice that the highest rate is among the African American population at 10.7%, followed by white at 9.1%, and Hispanics at 8.1%. Males are higher at 8.3% than female. Age, 18 to 25 at 21.5% is the greatest. Current alcohol use by race, the white population is at 56.7 as the greatest, followed by the African American population at 42.8% and the Hispanic population at 41.8%. Again, males are higher at 57.4%. And again, the 18 to 25 demographic is much higher at 61.5%. The following maps illustrate current drug trends as of 2009 across our state. The dots represent residences of individuals who are admitted to substance abuse treatment. I can only imagine what this map would look like if the dots were actually representing all of the people currently using illicit substances. These are only those, you'll notice underneath the maps, that represent residents of individuals who are admitted to substance abuse treatment. Many people don't seek treatment. They're not in treatment. The map on the left, marijuana, pretty much is everywhere, follows the population density of each town, of each city. Cocaine historically dominates in the urban metropolitan areas, but has been spreading to other cities. Methamphetamine, which we do have a large problem in Missouri, dominates in rural areas. In specifically Jackson County, which is a leading county in the nation when it comes to drug use and meth lab seizures. Heroin is predominant in eastern region, including affluent suburban areas. According to the DEA, they talk about the St. Louis region being connected to the Chicago supply line. Nearly 90% of the state's heroin-related deaths are from the eastern region. The dominant form of heroin in St. Louis is white powder heroin, and in Kansas City, black tar heroin is pretty dominant. Here are a few populations of concern both in Missouri and the United States. Pregnant women, negative effects of prenatal exposure on infants and children, fetal alcohol spectrum disorder. About 11% of pregnant women report current alcohol use. Intravenous drug users, more common with heroin and methamphetamine use, which is the preferred route of administration. This leads to an increased risk of HIV and hepatitis through the sharing of needles, oftentimes. 1 in 8 new HIV cases in Missouri is related to IV drug use. The estimated number of IV drug users in Missouri is almost 11,000. Mentally ill population. When I'm referring to the mentally ill, I mean those with a diagnosable mental illness according to the DSM-4, the Diagnostical Statistical Manual of Mental Disorders, 4th edition. Estimated 23% also have a substance abuse problem, may attempt to self-medicate to relieve mental illness symptoms. Continuing, adolescents and young adults. About 9% of Missouri adolescents aged 12 to 17 and about 19% of Missouri youth adults aged 18 to 25 have used illegal drugs in the past month. About 15% of Missouri adolescents aged 12 to 17 have used alcohol in the past month. Substance experimentation is common in the adolescent years. Use becomes more prevalent in young adult years. Of particular importance to you is Missouri's homeless population. Precise data is difficult to obtain because of the transient nature of the population, as I'm sure many of you are aware. An estimated 35% have chronic substance abuse problems. The number of reported homeless persons in Missouri on a given winter night in 2010, I believe this was a point and count night, was almost 7,900. And also, the last population of concern that I have here is the criminal justice population. The substance abuse problems are common among offenders committing property crime offenses as well as drug-related offenses. State and federal inmates who reported being under the influence of drugs at the time of their offenses is pretty high. Violent offenses at 28%, sexual offenses 17%, nonviolent offenses such as property crime at 39%, and drug offenses at 44%. For the Missouri Department of Corrections, about 82% of parolees and 61% of probationers need substance abuse treatment. Research shows that community-based substance abuse treatment is effective at reducing returns to prison. The directors and people at DMH are quick to point out that decreased funding for psychiatric and substance abuse issues leads to an increased demand on our corrections population. So, you know, as we spend less on substance abuse, then we end up with, you know, more people with longer sentences and a greater, you know, demand on our Department of Correction institutions. Next, it's important to be familiar with some commonly used substances. It's also important to be knowledgeable of the terms of the drugs in your area. I have here some abused substances and some names that they're commonly referred to as. Alcohol, some liquor, beer, wine. Marijuana, pot, grass, or weed. Hallucinogens, this is LSD, mushrooms, acid. Cocaine includes crack, coke, rock, and blow. Amphetamines, Adderall, Ritalin, beanies. Heroin, smack, China white, brown sugar. Opiates, Oxycontin, morphine, codeine, Vicodin. Inhalants, paint thinners, gasoline, aerosol propellants, nitrous oxide, poppers, snappers, whippets. Methamphetamine, referred to as meth, crank, ice, speed, crystal, and also one that we don't commonly think about, nicotine or tobacco, cigarettes, cigars, and chew. Alcohol affects every organ in your body. It impairs brain function and motor skills, increases risk of liver disease, and can result in memory lapses and even blackouts. Alcohol use during pregnancy increases the risk of serious birth defects, such as fetal alcohol syndrome. Severe alcohol withdrawal is called delirium tremens, or DTs, and some of the symptoms are seizures, fever, hallucinations, agitation, shaking, or vomiting. Alcohol is the most commonly abused substance in the United States. The average age at first use in the United States is 17 years. Over 16,000 Missourians were admitted to treatment for a primary substance abuse problem of alcohol in fiscal year 2010. Marijuana, some of the effects of marijuana is that it impairs short-term memory, cognitive functions, coordination, and balance. It increases your heart rate and can induce psychotic episodes. Some signs of use include rapid heartbeat, increased blood pressure, red eyes, dry mouth, increased appetite, and slowed reaction time. It is the most common illicit drug of abuse. It is the most common reason for treatment admission for adolescents in Missouri. Average age of first use in the United States is 17.9 years, almost 18 years of age. Over 10,000 Missourians were admitted to treatment for a primary substance problem of marijuana in fiscal year 2010. In Missouri, we are known to have a very large methamphetamine problem. Methamphetamine effects include increased attention and wakefulness, a decrease in appetite, euphoria, rapid irregular heartbeat, and even hyperthermia. Some long-term effects include addiction, psychosis, memory loss, violent behavior, severe dental problems, often referred to as meth mouth, weight loss, sensations on the body, crank bugs, and mood disturbances. It's more common among young adults in our rural areas in Missouri. It's the third most common reason for admission. About 3,700 Missourians were admitted to treatment for a primary substance problem of methamphetamine in fiscal year 2010. Missouri leads the nation in number of lab seizures. Primarily, this is for local use. The manufacturing process involves highly hazardous chemicals, and this poses a great risk to those cooking meth, those that live in the house, especially children, and even law enforcement personnel in charge of cleanup. This was a large problem for law enforcement personnel when meth first became a problem, because we didn't know the long-term effects of all these chemicals. Heroin, some effects include rush, depressed respiration, clouded mental functioning, nausea and vomiting, abnormal skin sensations, dry mouth, suppression of pain, and spontaneous abortion. Some long-term effects include collapsed veins, bacterial infections, abscesses, hallucinations, convulsions, and respiratory arrest. It leads to an increased risk of HIV, as we mentioned before, viral hepatitis, and tetanus as well. The average age of first use in the United States is a little bit higher at 23.1 years. About 90% of heroin-related deaths in Missouri are from the eastern region. 2,800 Missourians were admitted to treatment for a primary substance problem of heroin in fiscal year 2010. Some other emerging growing issues that have come up lately is prescription drug abuse, typically narcotics, OxyContin, Vicodin, and also stimulants, which are common among young adults, Ritalin, Adderall. Missouri has no prescription drug monitoring system at this time. So what that means is that, a person can be getting multiple prescriptions from multiple doctors, or doctor shopping and using multiple pharmacies. The estimated number of Missourians with non-medical use of pain relievers in the past year is 216,000. Recently, synthetic drugs have become a major problem. It's been very hard for our legislators to keep up with these new synthetic drugs as new ones keep coming out. These are often marked not for human consumption. Synthetic stimulants, often referred to as bath salts, plant food. This is not the case. They're not bath salts. They're not plant food. They are synthetic stimulants. They are drugs of abuse. Also synthetic cannabis, K2 or spice. Sometimes they're typically sold as incense. So that is a brief overview of Missouri's drug trends and populations of concern. We'll move on to the Rosie interview question. Do you or a family member have a substance abuse problem? Is the Rosie interview question that you guys are asked to ask of your population. We have listed here a few sub-questions to ask. Have you or a family member ever been diagnosed with a substance abuse problem? Have you or a family member ever been to treatment for a substance abuse problem, such as a detox program, been hospitalized in an inpatient or outpatient treatment, emergency room visit related to drug or alcohol use? Also, have you or a family member ever had legal problems due to the use of alcohol or other drugs? Here's some tips that I received from a coworker here that is an LCSW for asking questions and providing a comfortable environment when you are doing a one-on-one interview with somebody. It's important to provide a safe and confidential environment for the interview. It's helpful to remove barriers between you and the person being interviewed. You may not want to sit on one side of the desk and have another person sit on the other side. That's an example of physical barrier. It's important to kind of center yourself, remain calm, talk in a clear and concise manner, use short sentences that are easy to understand, use a quiet voice at a moderate pace. It's important to allow time for the person to process your question and provide an answer. One thing that I've really learned over time is that silence is golden. It's okay to have periods of silence. You can ask a question and give the person an opportunity to think. So how do we determine if this is a disabling condition? The definition that is in the Rosie system is that a disability as defined in Section 223 of the Social Security Act a physical, mental, or emotional impairment, which is A, expected to be of long, continued, and indefinite duration, which that would meet substance abuse, substantially impedes an individual's ability to live independently. This can often be the case, of such a nature that such ability could be improved by more suitable housing. A developmental disability as defined in Section 102 of the Developmental Disabilities Assistance and Bill of Rights Act. The disease of acquired immunodeficiency syndrome or any conditions arising from the etiological agency for acquired immunodeficiency syndrome. And the last, this is all word for word, a diagnosable substance abuse disorder. So under this definition, if they have a diagnosable substance abuse disorder, then it is a disabling condition. They have to have been diagnosed with a substance abuse problem by a qualified substance abuse problem. This can be a licensed clinical social worker, a licensed professional counselor, someone with that's a certified alcohol and drug counselor. The definition of substance abuse, according to the DSM-4, is that substance abuse is a destructive pattern of use leading to significant impairment or distress with 3 or more of the following conditions within the past 12 months. A need for increased amounts of the substance, tolerance. Experiences withdrawal symptoms. These withdrawal symptoms can include sweating, pulse above 100, hand or body tremors, insomnia, nausea, or vomiting, even hallucinations or illusions, and oftentimes anxiety, nervousness, or even seizures. Uses more than intended, cannot reduce or stop use, time consumed by getting and using the substance, reduces or abandons other activities, continues to use even knowing negative impacts on life. This slide highlights a commonly used tool that only utilizes 4 questions for helping to determine whether or not there is a problem. This brief screening tool is referred to as the CAGE aid. One yes answer suggests a possible alcohol or drug problem. Oftentimes, more than one yes answer means it's highly likely that a problem exists. Have you ever felt you ought to cut down on your drinking or drug use? Have people annoyed you by criticizing your drinking or drug use? Have you ever felt bad or guilty about your drinking or drug use? Have you ever had a drink or used drugs first thing in the morning to steady your nerves or to get rid of a hangover? If you think that someone you know might have an alcohol or drug problem, it's important to see a doctor, refer them to another healthcare provider as soon as possible. They can help you determine if a drinking or drug problem exists and then determine the best course of action. Questions that are helpful to ask include, do you currently or have you ever attended 12-step groups for alcoholism or drug addiction? Have you ever received treatment for substance abuse? Have you ever been diagnosed with a substance abuse problem? Again, according to the definition, if someone has been diagnosed with a substance abuse problem by a qualified substance abuse professional, then it would be considered a disabling condition. Some resources. The link that I have there is to the Division of Alcohol and Drug Abuse's homepage. I have there the address and telephone numbers of Central District Office. This is a screenshot to our website. On our website, you'll find a list of all of our treatment sites funded by the Department of Mental Health. There's also a link to the grant that I work on, the Access to Recovery grant. This includes resources for faith-based providers that provide recovery resources, and also a list of our recovery support sites. The statewide response for the Department of Mental Health, Division of Alcohol and Drug Abuse, and Comprehensive Psych Services. Our agency is responsible for the statewide response to Missouri's substance abuse issues. We do partner with other state agencies. We oversee a statewide network of community-based prevention, treatment, and recovery support service providers. And we're also responsible for overseeing the state substance abuse traffic offenders program, also known commonly as SATOP. Some other resources that are helpful to be aware of and possibly point your consumers to are some 12-step groups: Alcoholics Anonymous, Narcotics Anonymous, Cocaine Anonymous. I have included there the link to the homepage of Alcoholics Anonymous. And on there, there's a search tool where you can find meetings and meeting places and meeting times in your area. There's another, the other agency that I have listed there is the Substance Abuse and Mental Health Services Administration. This is the federal administration and on there is a treatment locator where you can find treatment resources in your area. So if you have any further questions after you've gone through this, please feel free to contact me. I have there my address and my phone number, and also daily check my email, timothy.rutter@dmh.mo.gov. And finally, I have listed there the Department of Mental Health's website. Thank you very much.